Hello there, lovely people. Welcome back to my YouTube channel. I'm so happy to be back. I've been sick the last couple of days. Last week I had chicken pox. It is very interesting because I never had chicken pox when I was a child, and now you can imagine when you get chicken pox when you're an adult. It is very interesting because there's fear of dying. I don't know why, but I don't know why. The first thing that came into my mind is the complications that comes with chickenpox in adulthood, and being in the medical field. There's that fear, like you've had stories of people who got chickenpox when they were old, like an adult, and the outcome was not very good. So I was really fearing for my life. But I thank God, here I am. And as you can see, I am well. Only that I've been left with some marks. But anyway. Yeah, so I had to give you that brief because, now back to my YouTube channel, back to what we do. We do inspiration here. If you are new on my channel, welcome back. And I'm so happy to be hosting topic on maternal health, and on this particular topic we're going to talk about the some of the problems that come about with pregnancy, or maybe let me just call them the complications of pregnancy, and I will just define them in very simple terms because I do not want to go into the tough medical terminologies. So the first one that we're going to start with is high blood pressure, and high blood pressure might just spring up in pregnancy, even if you did have history of blood pressure, even in your family or earlier on, you might just develop high blood pressure in pregnancy. And that is why you see, if you are pregnant or you've attended antenatal clinic, we always check for blood pressure for every antenatal mother whenever they come for the visit. And in case we realize that the blood pressure is like it's going up, we have to cater to maybe take care of that in good time so that we avoid the mother flipping into high blood pressure, which can lead to other complications like preeclampsia. That's also another complication by itself of pregnancy. But now high blood pressure in pregnancy can flip over to preeclampsia, whereabout preeclampsia is where we know that there is now the high bps, and then there is retention of fluids. That is why you'll see the mother maybe swollen, the face, the hands, all over the body. You might notice that the mother is swollen, and also there could be proteinuria, that is the presence of protein in urine. So in case now that the mother will realize she has preeclampsia, that one is going to be managed. Why am I maybe let me just highlight why am I bringing all this. It is because I want the mothers to know what can they expect, or maybe what to look out for in case you see yourself having some kind of changes in your body. You need to rush maybe for medical aid. The other thing that is quite common in pregnancy, a complication rather, it is gestational diabetes. This is also very common in mothers who are pregnant, and you might even have never had the diabetes history of it in yourself or even in other family members. And so when we notice that, that is why especially between 24 weeks to 28 weeks gestation, we get to take your blood sugars and to make sure that they are okay. In case we realize that they are not within the normal ranges, we are going to maybe send you for a fasting blood sugar. And in case now the fasting blood sugar is also high, we are going to make sure that we put you on a regimen, of course together with the medical practitioner, the doctors, and any other consultant that might need to get involved. And they are going to manage the diabetes, because that can flip over, either endangering the mother and also the baby. So that is very, very something that we have to take into account. The other thing that we have to check in pregnant mothers, infections are very, very common in pregnant mothers. And in case we notice that the mother has had infection, they need to be treated immediately, which if it's not treated, it can flip over to septicemia, which might affect the health of the baby or even the mother. And sometimes infection, when not treated, can be very, very fatal. The other thing that we also consider is anxiety and depression, which because there are changes in moods of the mother. That is why pregnant mothers have to be really, really taken good care of, and they need an environment where they are not stressed up. In case the mother gets the anxiety, or they are not in a good environment, they're going to develop the anxiety and depression, and that can affect maybe the mother, in that she's not going to be able to take care of herself well, and this is going to affect the health of the baby. And also it can also go up to delivery, whereby the mother might get the psychosis, puerperal bruise, and even depression, or what we call postpartum depression. The other thing that is very common in pregnancy is preterm labor. Preterm labor can happen for any mother. Uh, for some with something that associated causes, or sometimes some causes are not even, you cannot be able to get to know the cause, what caused the preterm labor. And sometimes you get the mother loses the baby, and that's why we need to make sure the mother is educated on what to look out for, the signs of labor. And in case she notices that she's going into labor and she's not yet term, that is before 37 weeks of gestation of pregnancy, she needs to go so that she can be checked, and the medical practitioner or the health caregiver is going to maybe take care of that, whereby we say we can be able to knock off labor and make sure that the mother can be able to sustain the pregnancy up to term. I did not want to go in so many, but those are the most common ones, and that we need to look out for every pregnant mothers. And so we continue to inspire you in this channel. If you have not subscribed, kindly do, and also give this video a thumbs up, and also comment below, and also share with your loved ones. Until next time, bye bye, and God bless you.